Hi, I'm Dr. Nilu Sunil of the Emergency Medicine Department of VSH Hospital, Alvital Malia Road. So catch me this week on all new episode of Ask the Doctor. Let's clear some doubts now. So the emergencies which are life-threatening are someone who is presented with a heart attack, who's had a road traffic accident and multiple injuries. He has multiple injuries, right from a head injury and other injuries. Other injuries and trauma can go undetected if they're not treated on time. And stroke is something where the awareness is primarily lacking in many areas. So this is also life threatening, and if treated on time, then the symptoms can revert. If not treated on time, the symptoms can be disabling, and also it can cost you your employment. So as I mentioned earlier, so when someone has had a heart attack can have many symptoms. So starting from gastritis, you might have acidity and you feel it's just acidity, but it could actually be a heart attack. So you ignore this for a couple of days, and by the time we actually come to the hospital, it's a little too late for us to save the victim. Sometimes they die en route, and the only symptom they would have told their attenders or patients and family would have known that they have had acidity symptoms. So, and anyone who's had chest pain, they might feel it's just some shoulder pain, just to some gas. So please don't ignore your symptoms. The earlier we treat you, your life expectancy is better, and the more we can we can treat you faster, the symptoms your whole life, whatever your quality of life is, better. So the later you present to the hospital with the symptoms, the later is the treatment survival rate. So that's why it's very, very important for all of us to be aware of the symptoms of a heart attack, of a stroke, of other life-threatening injuries like trauma. Multi-system injuries can be happening. So don't take it lightly if someone is presenting with acidity or even having severe headache. So these are some symptoms which we ignore. So when someone has stroke is something which can present as minimal symptoms as of giddiness. So you're feeling giddy, lightheaded, you're not able to walk. So then these are some symptoms which can go ignored. This is also a sign of stroke. You have severe headache which has never happened to you of that intensity before. This is also a sign of stroke. Then you have weakness in one arm or the other arm or your lower limbs. That is also a sign of stroke. So stroke can come with many different symptoms, but we need to be aware that if you are having, or anybody around you is having such symptoms as of giddiness and any imbalance in gait, they're having difficulty speaking, they're having difficulty moving the hands or limbs, or blurring of vision, severe headache, then please take them to the nearest hospital which is capable of treating a stroke. So not all stroke centers are, all hospitals are stroke ready. Most of the specialist centers are stroke ready. So you need to take them to the appropriate hospital. That is what is important. In trauma, when accident happens, what generally happens is the victim is lying on the road or wherever they are, and it takes a long time for them to be transported to the nearest hospital which can treat them at the earliest. So usually people gather, they call the ambulance, and by the time the victim is actually shifted to us, it's probably an hour and a half after the accident has actually happened. So we need to recognize that when a person has had severe injuries due to trauma or a road traffic accident, what we can treat in the first hour when they present to us can save them their lives. So only the injuries what you see from outside might not be the injuries they are having. They might be in a state of shock because they might be having some internal bleeding. So if they not got to the hospital on time, they may bleed internally, lose a lot of blood, and by the time, if it is too late and they present to us a couple of hours later, then it might be difficult for us to save them. So it is very, very, very important that they are immediately dispatched to the nearest hospital as soon as possible. Especially the first hour is very, very critical for a trauma victim.